Assalamualaikum warahmatullahi wabarakatuh and hi. Today, I, Nurul Syafiqah binti Bakar, AS011033, along with my group mates, will explain about the hypothalamus and pituitary gland. In this topic, we divided it into 4 sections and I will explain about the first section. Before we go further into this topic, we need to know what is actually hypothalamus. Hypothalamus helps in regulating the body's internal environment, and it is divided into 2, which is autonomic nervous system and pituitary gland, or also called as hypophysis. Autonomic nervous system controls heartbeat, blood pressure, appetite, body temperature, as well as water balance. While pituitary gland is divided into 2, which is the posterior pituitary and anterior pituitary. In this section, I will explain about the hormone that is secreted by the posterior pituitary but is controlled by the negative feedback, while Azimah is going to explain about the hormones that is secreted by the posterior pituitary but is controlled by the positive feedback. When the level of salt is higher than the level of water in the blood, that is when the ADH is released because the blood is concentrated. ADH influences the water to be reabsorbed, and eventually the blood will become dilute. So when the level of water and blood is balanced, where the blood is isotonic, then that is where the ADH is no longer released. And basically this hormone is controlled by the negative feedback. So next, I will be passed on to Azimah Nabilah to explain about the hormones that is controlled by the positive feedback. That is all from me. Thank you.
Hi, I am Azimah Nabilah, and I will talk about another hormone that is produced by the neurocirculatory cells in the hypothalamus, which is oxytocin. So let's get into it. Oxytocin is produced in the hypothalamus and is secreted into the bloodstream by the posterior pituitary gland. The 2 main actions of oxytocin in the body are contraction of the uterus during childbirth and the ejection of milk letdown during lactation. Oxytocin stimulates the uterine muscles to contract, which increase the contractions further. Same goes to during breastfeeding. Oxytocin promotes the movement of milk into the breast, allowing it to be excreted by the nipple. Oxytocin is controlled by a positive feedback mechanism, where release of the hormone causes an action that stimulates more of its own release. When contraction of the uterus, when contraction of the uterus starts, for example, oxytocin is released, which stimulates more contractions and more oxytocin to be released. In this way, contractions increase in intensity and frequency. There is also a positive feedback involved in the milk ejection reflex. When a baby sucks at the breast of its mother, the stimulation leads to oxytocin secretion into the blood, which then causes milk to be let down into the breast. The production of the hormone is stopped after the baby is delivered or when the baby stops feeding. Oxytocin is also present in men, playing a role in the propulsion of semen through male reproductive tract. And also, oxytocin also may affect the feelings of sexual satisfaction and emotional bonding. For example, bonding between a mother and her child. That's all from me. Thank you.
Okay, hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Hafiy bin Rahim, and I will teach you about hypothalamus. Okay, so yeah, hypothalamus will control anterior pituitary by producing hypothalamic releasing hormone and hypothalamic inhibiting hormone. Hypothalamic releasing hormone will stimulate anterior pituitary to produce thyroid stimulating hormone, and second, hypothalamic inhibiting hormone will prevent anterior pituitary from producing prolactin. Okay, what is function of thyroid stimulating hormone and prolactin? Thyroid stimulating hormone is the hormone that used to stimulate thyroid gland to produce thyroxine, and prolactin is the hormone to make breast milk when woman in pregnant only. Okay, I will continue to the second section, which is anterior pituitary gland affecting other gland. First hormone is gonadotrophic hormone, and the simple name is GDH. Function to stimulate the gonad. For example, testes for male and ovaries for female. Function is to produce gamete and sex hormone. Second, ACTH. ACTH stand for adrenocorticotropic hormone to stimulate the adrenal cortex to produce cortisol. Cortisol is steroid hormone to help and balance blood sugar level. And lastly is the TSH. TSH stands for thyroid stimulating hormone. Function, refer to their name, is to stimulate thyroid and produce T4 and T3. When the production of T4 and T3 is enough, it will produce negative feedback to inhibit the formation and or secretion of the hormone. Okay, that's all from me. Thank you. Enjoy your holiday.
Assalamualaikum warahmatullahi wabarakatuh. My name is Natasya binti Syamsol, and now we'll talk about hormones not affecting other glands. So, hormones not affecting other glands, we have three, which is prolactin, melanocyte stimulating hormone, and also growth hormone. So, in prolactin, what is prolactin? Prolactin usually produced in quantity only after childbirth. So, it doesn't mean it have in a woman only, it's also have in men. So, prolactin causes mammary glands in the breast to develop and produce milk. And it plays a role in carbohydrate and fat metabolism. So, a normal range for prolactin in non-pregnant female is 2 to 29 nanograms per milliliter, while in pregnant women, it has 10 to 209 nanograms per milliliter. It also have in males, so normal range for prolactin in male is 2 to 18 nanograms per milliliter. If there is too high of prolactin in female, it will cause irregular menstrual period, while in pregnant female, it will cause milk discharge from the breast. While in male, it will cause low testosterone, which will lower the muscle mass and strength in male. So, if the range of the prolactin is lower than normal, it will cause the pregnant woman to produce insufficient milk. So the next one is melanocyte stimulating hormone, which is MSH, or we call it, so the keyword here is melano, which comes from melanin. So it will cause skin color to change in fishes, amphibians, and reptiles that have melanophores. So these melanophores can produce color variations. For example, in fishes and frogs. So the concentration of MSH in human is low. MSH in humans plays a role in producing colored pigments in the skin, hair, and eyes. So the last one is growth hormone. So growth hormone, or it called as somatotropin, it promotes skeletal and muscular growth. So these growth hormones increases the rate of amino acid enter the cells, thus protein synthesis will occur. So it also promotes fat metabolism as opposed to glucose metabolism. The amount of growth hormone produced is greatest during childhood and adolescence. Little GH will lead to pituitary dwarfism and also cause low blood sugar, or we call it as hypoglycemia. If it's too much GH produced, it will lead to the person becomes a giant. So if the human becomes giant, he or she will have poor health. So if the GH is overproduced in the adult, it will result to acromegaly. In adult, long bone growth is no longer possible. Okay, so except for feet, hands and face, which in specifically chin, nose and eyebrow ridges. So these portions such as feet, hands, chin, nose and eyebrows ridges, it will become overly large only at this certain place. Some of people in every website, in some website, they sell growth hormone. Many of our athletes use for them as a steroid, but GH is not a steroid. If it is consumed too much, it will cause many side effects such as joint and muscle pain, high blood pressure and also diabetes mellitus. Okay, that is all from me. Thank you. Don't forget to wash your hands frequently. Don't forget to wear hand sanitizer. And please stay at home. Okay? Okay, that's all from me. Thank you.